Hello, everyone. I want to start this presentation by introducing myself. My name is Morgan Noble, and I am in the 2020 Family Nurse Practitioner graduating class at Arkansas State University. The title of my research presentation is Pediatric Obesity Screening Rates. This presentation is a culmination of the work I have done over the last year and a half of this graduate program. I would like to take this opportunity to introduce my faculty mentors that have played a significant role in this research. They are Dr. Chris Jordan, who is my advisor, and Ms. Tanya Mead, who is my clinical instructor. This is the poster that would have been displayed at Create AState. This poster displays the introduction to the research, the purpose and objectives of the research, the methods of the research, the population that was included in the research, the findings of the research, the discussion, and the action plan. It also displays the acknowledgments and references. I know this is difficult to view in this format, so I have broken the poster down into different slides to make it a little bit easier to see. I think we would all agree that obesity is a problem in our country that affects all populations, and the pediatric population is no different. This puts these children and adolescents at risk for poor health. The prevalence of obesity is 18.5%, and that translates to about 13.7 million children and adolescents ages 2 through 19. Obese children and adolescents have an increased risk of developing type 2 diabetes, asthma, fatty liver disease, cardiovascular disease, and they may also experience more mental health and psychological issues like depression and low self-esteem. In order to combat these statistics, the United States Preventive Services Task Force recommends that clinicians screen for obesity in children and adolescents 6 years and older and offer or refer them to comprehensive intensive behavioral interventions to promote improvements in weight status. The purpose of this study is to analyze what percentage of children and adolescents ages 6 through 18 are being screened for obesity in a local clinic in Manila, Arkansas. And then if they are overweight or obese, are they being offered comprehensive, intensive behavioral interventions to promote improvements in their weight status? This is a chart that I found on the CDC website that I found interesting. It kind of goes along with the statistics that I found, and it just shows the prevalence of obesity among youth ages 2 through 19. And this chart goes on and breaks it down by sex and age. And if you will look, you can see that once kids reach 6 years old, from that point as they age, the prevalence of obesity increases. The objective of this study is to analyze the pediatric obesity screening rate of a rural Arkansas clinic with the national screening rates in consideration of the recommendations by the United States Preventive Services Task Force for all children ages 6 through 18. In determining whether the pediatric obesity screening practices at this clinic are better or worse than the national average, providers will be able to gain insight into their current screening practices and provide a reference point that they can utilize to set future goals. Now we're going to talk about the methods I used to obtain this research. First, IRB was obtained through Arkansas State University. The study was conducted using a retrospective chart review, and then 50 charts were reviewed through an EMR in a rural primary care clinic in Mississippi County, Arkansas. A data collection tool was used to gather and record data, and the data collected included age, gender, BMI, whether or not a screening was performed, and if interventions were offered. The population included both male and female patients ages 6 through 18 who visited the clinic between the dates of January 1st, 2017 and November 15th, 2019. Exclusion criteria included patients who were younger than 6 or older than 18. This study found that the rate of obesity screening in a rural clinic in Mississippi County for children ages 6 through 18 is 100%. 34% of the 50 patients that I reviewed were found to be in the obese category. My intention was to compare that percentage to the national screening average, but I was unable to obtain that through my research. Therefore, a comparison could not be made. When we consider the recommendations made by the United States Preventive Services Task Force for these individuals, screening practices of the practitioners at this rural clinic that I was at were found to be satisfactory. However, there is still room for improvement. The study concluded that this clinic screened 100% of their patients. Of the 50 charts that I reviewed, 17 of them were found to be in the obese category. Only 35% of that 17 that were found to be obese were offered comprehensive behavioral intervention. So this leaves significant room for improvement in that aspect of the recommendations. The acknowledgments we've already mentioned, and then the references are here on the bottom right.